Hello, my name is Nancy Richak. The topic is Transplanting Hepatitis C positive kidneys. And definition is patients with eight-stage renal disease are the high risk of recurrent parentally transmitted infections such as the hepatitis C virus. The prevalence of hepatitis C virus infection in this patient lists in the development of chronic liver disease, especially after kidney transplantation.
Transplanted 10 patients. In the expander study, we transplanted 10 patients with kidneys from hepatitis C positive deceased donors and treated them simultaneously with antiviral medications for hepatitis C. We had excellent transplant outcomes in these recipients and were able to prevent long-term transmission of hepatitis C from the donor to the recipient. So we were able to successfully treat all 10 recipients and prevent long-term transmission of hepatitis C from the donor to the recipient. They also had excellent outcomes following the transplant in terms of kidney function and recovery. Currently, there are about 1,000 kidneys per year in the United States that are not utilized because the donor is hepatitis C positive and there's no appropriate recipient to place them into. They're otherwise excellent kidneys, so we hope to be able to use them in recipients that already have a long wait for a kidney transplant and treat them with the antivirals that can successfully treat hepatitis C. And so long term, we hope to transplant many more patients with hepatitis C positive kidneys along with treating them for hepatitis C to have both a successful transplant outcome and also prevent transmission of hepatitis C. We hope to take the results of the expander study and apply it to other organ groups as well, especially patients waiting for heart transplants and lung transplants. Both of these populations could benefit from a shorter waiting time. And since there are organs from hepatitis C positive donors, both hearts and lungs that are currently discarded because there isn't an appropriate recipient to put them into, we hope that we can put these kinds of transplants into hepatitis C negative recipients, treat them with the antivirals for hepatitis C, and have successful outcomes.
An application in medicine is patients with positive virus hepatitis C RNA remaining positive also always during post-transplantation follow-up. The virus hepatitis C RNA titers are not different in patients with or between post-transplantation liver disease, so they may not play an important role in the presence of post-transplantation EHC.
I'm looking forward to traveling with my grandkids, spending more time with the kids. Go back.
One day I was at work and my cell phone rang and I answered the phone and David Goldberg from UPenn was on the other side of the line.
I did get a call from Dr. Goldberg. The funny thing is, at first I thought it was like a prank call. I got on the transplant list in October 2014.
The doctors also said that if I were to find a donor and go for kidney transplant prior to dialysis, that would be the ideal situation.
I think because of my blood type, I wasn't going to see a transplant for 5+ years.
What we learned is that there are hundreds of kidneys from people with hepatitis C that are donated, but they're never used. They're literally discarded. So this study brings those kidneys to people who need it. We're doing transplants that were never done before. We're giving people hepatitis C with a transplant and then trying to cure them afterwards. So we chose people who had many years of waiting time ahead, people who were already on dialysis. And then the third piece of it is that we were really insistent on choosing people who could go through an intense informed consent process.
So once I got the material, I just read through it. I gave it to my son, my daughter, my friend, my sister, so they can all read it, so I can get their impression, their thoughts on it.
So the theory is that if I were to receive a Hep C kidney and develop Hep C myself, then they have a plan to treat me with Zapitir and be able to cure my disease.
People have to opt in to get a hepatitis C positive kidney. And so what happened at our center was that we brought these people in for multiple visits with a lot of education. After all of that and an extensive informed consent process, then we could check the box and they could get those offers.
My son looked at me and said, "Mom, this is a no-brainer." Very clear. My daughter said the same thing.
When I first enrolled and they told me that the transplant would be quick, I was actually hoping that he'll just say maybe a year or 2 years. To my surprise, he said it'll be a few weeks to few months.
Performing transplants is really just a wonderful opportunity to improve people's lives. We take care of individuals who come to us who are incredibly sick, whose lives have been devastated by end organ disease. In particular, patients with end-stage renal disease on dialysis usually can't work. It's a large burden on their families, and so the opportunity to perform a transplant successfully is incredibly meaningful because you can turn around someone's life.
When patients get transplanted, we're checking their blood to see if they have detectable hepatitis C on post-transplant day 2 or 3. One of the unknowns is, will every patient develop hepatitis C?
So I did get the disease. They told me this the day after surgery, and they started me on the medication that Friday. It went down dramatically. I couldn't believe it. And the following week, it was completely gone.
So once they have detectable hepatitis C in their blood, we're treating them with a medication called Zapitir, which is 1 pill a day for 3 to 4 months. That is along with all of their standard post-transplant medications, which are not altered in any way. Among the general population, Zapitir cures more than 95% of people with chronic hepatitis C.
We estimate that there will be somewhere between 400 to 1,000 additional kidney transplants from hepatitis C positive donors if this trial is successful.
I'm looking forward to traveling with my grandkids, spending more time with the kids, go back to the things that I enjoy doing.
And she was just so excited about that simple pleasure that we all take for granted, and it was so gratifying to hear that.
Now that I have energy, I'll be picking up playing tabla, the Indian drums again. I'm also a gym rat. I go to gym every day. I want to get back into that routine. So now I'm feeling confident after the transplant surgery that I'll be able to do all that.
What's been really gratifying is that with Irma and some of our earliest experiences, that they've responded to therapy right away.
They've given me my life back.
All these doctors and plus the nurses, they were phenomenal. They changed my life.
Pro accounts and pros is survival of virus hepatitis C positive patient in higher after kidney transplantation than dialysis patient. And kidney transplantation is not contraindicated in dialysis patient infected with virus hepatitis C or virus hepatitis B. And cons and mortality due to chronic liver disease currently represents the third cause of death in kidney transplant patients, behind cardiovascular disease and neoplasm. Begin the rise of transmission of hepatitis C virus throughout the transplanted organ. Considerable controversy have been generated about the use of organs from donors and virus hepatitis C. Its use began restricted on some occasions to vital organs, and heart and lung and liver.
Has actually increased because of opioid overdoses. A silver lining to a sad reality. Doctors say the supply of hepatitis C infected kidneys has actually increased because of opioid overdoses. With needle drug use, the hepatitis C infection is not uncommon, but thanks to new drugs available, those kidneys could be transplanted into patients with end-stage renal failure who also have hep C. Stats show about 15% of patients undergoing dialysis for serious renal disease are also infected with hepatitis C. Taking that and other factors into consideration, Dr. Mark Ekman from the UC Division of General Medicine did computer analysis to ultimately determine this, that it is better to wait less time for a kidney by getting an HCV-infected organ as long as treatment for the HCV follows transplantation. One of the reasons you cut dialysis time. Consider this, the wait for a non-infected kidney is typically 2.5 years. The wait for an organ from an infected donor is about 2/3 of a year.
You're saving about 12-13% mortality risk by transplanting sooner. It's a waste to discard these otherwise healthy organs, again, now given the fact that hepatitis C is so treatable.
The UC study is one of a few happening in this area of medicine. At least 2 others have looked at transplanting a hep C infected kidney into a non-infected patient. Any strides made could ultimately reduce wait times for folks on the kidney donation wait lists.
And besides applicar in Ecuador, at the Jose Carrasco Arteaga Hospital in Cuenca in 2007, March, and 2012, they saw that the cause of chronic kidney disease are not stability in most cases. There is a significant percentage of patients receiving kidney graft from liver donors. Survival don't seem to be affected by variables such as sex and origin of the graft, age, and time of dialysis. The main complications are related to the surgical act.
Oh yeah, we do have bears up here. It reminds me of Night of the Living Dead, believe it or not. You see how the zombies are walking towards you? That's exactly what they look like coming out of dialysis. I'm not kidding. Here we go. Say hi. The concept of getting a very good kidney with small traces of the virus and then getting treated for the virus that's curable, it just makes sense to me. That's funny. I was thinking of putting it on this side. I can attach it. If they didn't have this study, I wouldn't be where I am today. So I'm extremely grateful. I mean, it's so weird. I feel like I'm such a bad patient.
We're giving them the opportunity to have a transplant, but we're also treating them for a new infection that they didn't have. So that's the trade-off. There's a whole pool of kidneys that we just kept looking over. It was like we had blinders to it.
And unfortunately, if the numbers keep increasing, the number of available organs that we could use might actually continue to increase as well.
In conclusion, is patients with virus hepatitis C infection more frequently develop biochemical liver abnormality and more severe pathologic condition than virus hepatitis C negative patients. And virus hepatitis positive kidney transplant patients with a mean follow-up of 7 and 4 years show that the survival of the patient and the graft.
Douglas Hayes was in that line for 2 years.
I was on stage 3 for several years. And then it went to stage 4 in about half the time, and then all of a sudden it was stage 5.
He was battling kidney failure, on dialysis waiting for a healthy organ.
Even dialysis doesn't replace all the things that the kidneys do.
Typically, patients in kidney failure need a transplant soon, or they will likely pass away from complications.
Any new issues since we last saw you?
So that's when Dr. Asif Sharfadin suggested he'd consider taking a Hep C positive kidney, which usually comes from drug users. Only a handful of hospitals do these types of transplants.
If we can use every single organ, the wait time becomes shorter for everybody.
Dr. Sharfadin says roughly 500 Hep C positive kidneys are thrown away every year across the country, even though the cure rate is pretty high now, close to 100%.
500 kidneys, it doesn't sound like a big number, but those are 500 lives which are saved right away.
And one of them is now Douglas. He has a new kidney and is now cured of Hep C after taking a pill.
All the risk factors didn't seem to be as bad as what could happen if I didn't get a new kidney.
A whole new life, waiting in line for only 3 weeks after making his decision.
I've got that accomplished, and now I can kind of get on with life.
For Fox 59 News, I'm Kilarinki. You heard
Thank you.